Often we confuse with the concept of upper and lower respiratory tract or system. To have a clear concept of upper and lower respiratory system, we must know the functional anatomy of the respiratory system, and in this video we are also going to tell about the functions of respiratory system. Respiration is defined as the process by which oxygen from the atmosphere is delivered to the tissue. Oxygen from the atmosphere, it is delivered to the tissue, and carbon dioxide from the tissue, which is produced due to the metabolism. This carbon dioxide from the tissue, it is removed into the atmosphere. So this respiration, it has got 4 stages. So first stage is the ventilation. We know that in the stage of ventilation, there will be entry of oxygen into our system, into the lung, and there will be exchange of gases between the atmosphere and the pulmonary capillaries. It is due to the process of ventilation. Now ventilation will be followed by the perfusion and diffusion. So when the oxygen is entering into the alveoli, it has to be diffused into the blood vessels, that is the blood of the pulmonary capillary which is surrounding the alveoli. And the movement of blood across this pulmonary capillary, it should be uninterrupted and it should be there. Okay, so ventilation is the entry of air, and then we have the diffusion and the perfusion. Now the third step is the transport. So when this oxygen has entered into the blood, that means it has to be transported to the tissue, and this is done by the mechanism of transport. At the level of tissue, we know that there will be exchange of gases. So we can see here, so this is the tissue and this is the RBC which contains the oxygen. Oxygenated RBC is red in color. So it is giving oxygen to the tissue, it is taking carbon dioxide and it is moving again back to the lung, so that via the process of ventilation again the carbon dioxide can go out. So we can say that the respiration takes place in 4 stages: ventilation, diffusion and the perfusion, transport and the exchange. And in addition to that, another step is that the central nervous system has got a kind of regulation on this whole process. If we consider the function of the respiratory system as a whole, respiratory system has got some respiratory function and non-respiratory functions. The respiratory functions, most important is the gaseous exchange. Lung is the central structures in respiration. Inhalation of oxygen into the body and removal of carbon dioxide from the body take place through the lungs. And the second important function is the regulation of blood pH. By controlling carbon dioxide output from the body, the lungs control the plasma bicarbonate concentration. We know that carbon dioxide, when it combines with H2O with the help of the enzyme carbonic anhydrase, it will form the H2CO3 or carbonic acid, which will be dissociated into H plus and HCO3 minus or bicarbonate ions. So this bicarbonate concentration ultimately regulates or controls the pH of the blood. So these two are the major functions, respiratory functions of respiratory system. Now, to have an idea of upper and lower respiratory tract, we must know the components of respiratory system. Practically, respiratory system is divided into 2 parts: the upper respiratory tract and the lower respiratory tract. Upper respiratory tract consists of the structures from the nose to the vocal cord, and it will include the paranasal air sinuses, glottis, pharynx, larynx, whereas lower respiratory tract consists of trachea, airways and alveoli. The respiratory apparatus also consists of thoracic cavity associated skeletal muscle, and the muscles of respirations. Now the first part of the upper respiratory tract is the nose. Nose contains olfactory epithelium. You can see this yellowish area, it is the olfactory epithelium that receives the smell sensation. Another function of nose is to filter the particles which has the diameter more than 10 micrometer. So we know that these nasopharyngeal airways, it is exposed to highest concentration of external substances. It may be the inhaled allergens, toxicants, or any other particulate matter. Okay, so in addition to olfaction, the nose and upper airway should provide two additional crucial functions in the airflow. First is the filtering out the large particulates to prevent them from reaching the conducting and the alveolar airways. And second is serving to warm and humidify the air. Okay, so in addition to the olfaction, nose helps in the filtration of particles greater than 10 micrometer in diameter. In addition to that, nasal mucosa, it secretes some secretions which contains immunoglobulin and interferons that kill the organisms. Though the volume of nose is only 20 ml, you can see the cross-sectional area of the nose, it is very high and it is increased by the presence of nasal turbinates. Another important point about nose is it offers 50% of resistance to airflow in the respiratory system. And we all know that when we have the common cold, this resistance to airflow in the nose, it will be increased. Now the second part of the upper respiratory tract is the pharynx. Pharynx is divided into three parts. One is the nasopharynx, oropharynx, hypo or laryngopharynx. Nasopharynx, you can see it is located behind the nose and it extends from posterior nair. So this is a posterior nair up to the level of the soft palate. In this picture we can see this is the soft palate. So nasopharynx, it takes origin from the posterior nair to this soft palate. Then we have the oropharynx. Oropharynx is located behind the mouth from the soft palate to the level of the hyoid bone, this yellowish part. And then we have the laryngopharynx. It starts from the level of the hyoid bone and it opens into the esophagus. So infection of this nasopharynx, it is much more common. And what are the functions of it? It helps in the deglutition, it helps in the respiration, it helps in vocal resonance, mucus secretion, drainage of nose and oral cavity and middle ear. Now the third component is the paranasal air sinuses. They are present almost around the nasal passage. They are mainly, we can see here, the maxillary sinuses, ethmoidal sinuses, sphenoidal sinuses, frontal sinuses. These sinuses open into the nasal turbinates and that makes them vulnerable to nasal infection. So they have three major functions. They offer resonance to the voice. They lighten the skull, for which upright posture becomes easier. How they lighten? Because they are air-filled cavities. So that's why they trap air and helps to lighten the skull. And they also provide protection to brain during facial trauma. Okay, as they contains air, so there will be a kind of protective action. And so directly any kind of external injury cannot be applied on the brain. So in this way, these are the three major functions of the paranasal air sinuses. Now what are the clinical importances of this paranasal air sinuses? These sinuses open into the nasal turbinates through their ostia. Now during inflammation and edema of nasal mucosa, these ostia of sinuses are readily blocked. So if we have the common cold or any kind of inflammation, when nasal mucosa it is inflamed, So the opening of these nasal sinuses, paranasal sinuses, they will be blocked, and this results in retention of secretion in the sinuses, which in turn will cause the sinusitis. So this is the clinical importance. Now, upper respiratory tract infections, or URTI, are probably the common of all infections. The commonest of all is all we know, that common cold that manifests mainly by the acute nasopharyngitis with the features of increased nasal secretion, sneezing, mild and temporary nasal obstruction due to the nasopharyngeal mucosal edema, and there may be also mild increase in body temperature. Other type of infections may be the pharyngitis, laryngitis, sinusitis, even the otitis media, that is the inflammation of the middle ear, that is also included into URTI, or upper respiratory tract infection. Tonsillitis is also included into URTI. Although the trachea is the continuation of the larynx, but the larynx is actually included into the upper respiratory tract, and larynx consists of epiglottis, arytenoids, and the vocal cords. Now these epiglottis and arytenoids, they cover the vocal cord during the time of deglutition. So why it is necessary? So when we actually deglute, we swallow something, the vocal cord will be covered by epiglottis and arytenoid. So the food will not enter into the airway. Food particles will go into the esophagus. Okay, so this is one important function, that is during swallowing, reflex contraction of the adductor muscles that close the glottis, and it prevents the aspiration. And we know that if the person is unconscious, or in case of anesthetized persons, these reflex, that is reflex covering of the vocal cord, it is incomplete, and what happens, there will be aspiration, entry of food particle into the airway, and that can cause aspiration pneumonia. So this is one function, that is the adductors of the larynx, they actually prevent this aspiration pneumonia. In addition to adductors, we have the abductors of the larynx also. Abductors of the larynx, okay, if they are paralyzed, which will produce the closures of this vocal cord and larynx, and there will be severe respiratory distress or inspiratory stridor. Okay, so laryngitis, if it is severe form, it can be very fatal. Now the second component is the lower respiratory tract. The lower respiratory tract consists of airway, tree, and the lungs. We can see here the trachea, it will be divided into two mainstream bronchus, then they will be further segmented. They will form the bronchioles, then terminal bronchioles, respiratory bronchioles, alveolar duct, alveolar sac, all are included into the lower respiratory tract. So airway, tree, and the lungs, it is the lower respiratory tract, and airway tree consists of trachea, which bifurcates into main bronchi, and then they will be segmented further. Now what do we mean by the lower respiratory tract infections, or LRTI? It may include the bronchitis, it may be the bronchiolitis, it may be the tracheitis, or the pneumonia, or the lung abscess. All are included into the term LRTI, or lower respiratory tract infection. Now we know the major respiratory functions of the respiratory system, that was the gaseous exchange and regulation of blood pH, but lung also has some non-respiratory functions. One is the left ventricular reservoir. The entire cardiac output from right ventricle is pumped into the pulmonary circulation, and due to their high compliance or stretchability, pulmonary vessels normally accommodate at about 0.5 liter of blood at any given time. So it serves as a reservoir for left ventricular filling. Second important point is the filtering small emboli from the blood. Venous blood normally contains microemboli from blood clots, fats or air bubbles. If these emboli escape into systemic arterial circulation, so tissue damage may occur. So pulmonary vasculature traps and removes these emboli before they get the chance to enter into the systemic circulation. And the third important point is that many chemical substances are removed in the lungs. Lungs decide which chemical substance should reach systemic circulation. So substances that are removed by lungs are prostaglandin E1, prostaglandin E2, leukotriene, serotonin, bradykinin. These are the chemical substances. Then olfaction, we know that is done by the olfactory epithelium of the nose. Then the processing of air, inhaled air, that is filtration of the air, making it warm, humidification, moisturizing of the inhaled air. It is done by the conducting airways of this respiratory system. Now the next function is the endocrine function of the lungs. Then the defense function, because in our next video we will see that there are pulmonary alveolar macrophages which are very helpful because they play a role in the non-specific defense mechanism in our body. There are secretions from the epithelium which contains immunoglobulin A. It maintains the integrity of the mucosal lining and provide resistance to the infection. Epithelium of lung contains protease activated receptors which that on activation releases prostaglandin E2, which protects the pulmonary epithelial cells. So these all are the defense functions of the respiratory system. And it also helps in the speech because movement of air in the respiratory passage help in the improvement of the voice. And also vocal resonance is also provided by the respiratory system. And this is also the route of administration of anesthesia. General anesthesia is usually administered via respiratory route. Now we want to focus a few points more about the endocrine function of the lung. So angiotensin converting enzyme, it is mostly secreted by the endothelium of the pulmonary blood vessels. So from where it will be synthesized, that is from the endothelium of the pulmonary blood vessels. We know that angiotensinogen is secreted from the liver. It will be converted to the angiotensin 1 with the help of renin, which is secreted from kidney. Angiotensin 1 is converted to angiotensin 2 with the help of the enzyme angiotensin converting enzyme, and this is secreted from the endothelium of the pulmonary blood vessels. And we know what is the function of angiotensin 2. Angio means blood vessels, tensin means it increases the tension on resistance. So angiotensin 2 is a potent vasoconstrictor. In addition to that, it also helps in the secretion of aldosterone from the adrenal cortex, which helps in the maintenance of sodium and water balance. So these are the non-respiratory functions of the lung. So in this video we have covered the functional anatomy of the respiratory system, the functions of it, both the respiratory and non-respiratory, and we gave a clear concept about the upper and lower respiratory tract. Thank you and subscribe. These are the references.